Hey, what's going on? It's Dr. Buck. In this video, I'm going to go over a little BLS or CPR, whatever you want to call it, and then maybe we'll talk about a little trauma-based stuff. So yeah, I appreciate all the requests and all that good stuff. I'm going to get to those, just not today. Okay? I'm going to get to them. I did get a request actually for this one, which was basically, what do you do if you come upon somebody who is, you think that they have a cardiac arrest, like a heart attack, or they got hit by a bus or something like that. So kind of go over the CPR at the beginning, the basic stuff, and then I'm going to tell you what we do like in the trauma bay, and this would not be for a heart attack, but if somebody gets hit by a car or they get shot or something like that, we have a little algorithm. It's pretty simple. I'll go through that very quickly, nothing in depth, but just kind of some fun stuff, okay? So first of all, this is, not a certification or anything like that. I'm just gonna go real quick through CPR. So what happens if you come up on somebody, you're in the office and somebody, just like tips over. Old Frank, he's a little, soft around the edges there. He likes his bacon cheeseburgers, and he walked up 2 flights of stairs and then just collapsed on the floor. So you go over to Frank, and first of all, anytime you're the first responder, you want to make sure that you're not endangering yourself. So you walk over there, and even though you're pretty sure that you're safe, you're on the street and a piano falls on somebody, and you go to save them from the piano. You want to get them out of underneath the piano. You want to make sure there's not another piano going to fall on your head. So there's only one victim and not 2 victims, because one, you're not going to help yourself. Anyway, so you make sure that the area is safe, and you walk over and you kind of shake him and say, "Frank, are you okay?" Because we're going to do chest compressions. Basically, we're going to get out and what we're going to get at, and then we're going to do also mouth to mouth. And you don't want to give Frank mouth to mouth if you don't have to give mouth to mouth to Frank, right? So you shake him and be like, Frank, are you okay? Right? And he goes like that. So that's the universal sign that he's not okay. So if Frank is not okay, all right, what if you shake him and he wakes up and he goes, hey, okay, I'm fine. Okay, fine, great. 2 things. If you shake him and he doesn't do anything, you can do a couple things. If you know how to do it, if you're comfortable doing this, that's great. If you're not, then we'll just skip that and go right on. So you can check for a pulse, and you can check for their breathing. So you can check and see. Basically what I do is look at their chest and see if it's going up and down symmetrically, okay? And you can feel their breath or their nose, or you can put your ear down to their mouth or nose and see if you can feel the breath on your face. And also I look at the chest at the same time and see if it's rising and falling. If none of that is happening, you assume that he's not breathing for whatever reason. If you know how to check a pulse, you can check a pulse. If he doesn't have a pulse, then we're assuming he's had a heart attack, something like that is going on. So he needs basically CPR, right? This is where we go. But before we go do CPR, we want to make sure we call for help, because if we start CPR, then you really can't stop CPR until somebody shows up. And if you don't ever call anybody, then nobody ever shows up, and you're going to get tired, and you're not going to help Frank at all. So you want to call somebody, make sure that either somebody is in the office and you go, oh, okay, go get help, call 911 or something like that. If there's nobody else around, what you can do is dial 911 on your cell phone, hit speaker, and then start doing chest compressions. And then when they answer, they're going to tell you what to do. So, and if no one's ever done chest compressions before, this pretty simple. So you take the sternum, okay, this is the breastbone right here. You go basically the lower third of the breastbone and a little bit to the left of that, and you place your palm right there, and you can't really see. But anyways, I kind of do this thing like that, right? And you lock your arms out, okay? And you kind of lean over the top of them like this, and you're going to do 1, 2, 3 like that. And then how fast do you do it? It's about 100 to 120 times a minute. And a really easy way to remember that is the song. Remember the "Staying Alive" by the Bee Gees? I'm not good. Maybe that should be cut out. But anyway, so you're gonna think of "Staying Alive" song in your head, and you're gonna do that to the beat. Okay, you want to make sure you keep your arms locked out, mostly because you could. So you keep your arms locked out, and you're going to do the staying alive to the Bee Gees. And then you push down about 2 to 3 inches on the chest. Okay, you want to make sure it goes down about 2 to 3 inches, and then you want to make sure it recoils, comes all the way back up. You don't want to come too far off. You don't want to come off and bounce around. You want to be bouncing on their neck or stuff like that. But you want to keep your hand on the chest, come up, go down 2 to 3 inches, come back up, 100 to 120 times a minute. Bee Gees, easy, right? So you're asking about the mouth-to-mouth of Frank. So here's the deal. The recommendations currently are that you do 30 compressions to 2 breaths. And however, there's a little caveat there. The most important thing at this time, we think, is the compressions and not so much the breath. Every time the blood goes around the circulation, about 25% is taken out. 25% of the oxygen is taken out of the blood. So when it goes around one time, you go from 100% to 75%. You have a good amount left. So it's going to go around another time without any additional oxygen. You're going to still have some oxygen left. So you can go for a while without any breaths. And we think that right now the most important thing that for the body to have is the circulation. Because if you're not getting good circulation, you're giving the breaths, it's really not doing anything because the blood's not going anywhere. The oxygen is going into the lungs. The blood basically goes to the lungs. It doesn't move out of the lungs, and it doesn't give any oxygen to anything else, any other organ, which is the most important one, is basically your brain, right? So that is the current thinking. So 30 compressions, 2 breaths. However, you don't have to give the breaths if you can't do it, or you don't know how to do it, or you don't want to do it, and you got help on the way. The compressions are the most important thing. So that's the short version of CPR/BLS, which is basic life support. That's assuming heart attack and I'm assuming a lot of things. I skipped a whole bunch of stuff. This is not a certification. If you like this stuff, if you think it's cool, and you're like, hey, I can do that, I should do that, you can do it in one day. So you should go get certified. It's it's a fun course, and you get some good knowledge. All right, so next thing I want to talk about is what happens when those patients come to the trauma bay. Say like it's a car accident, and the paramedics pick them up and they bring them to the trauma bay, or old George, he was sitting on his porch reading his Bible and he got shot. These 2 dudes walked up and just shot him for no reason. He never seen these dudes in his life. He just was like chilling, reading his Bible. His grandma was sitting there drinking lemonade. He got shot. So what happens in the trauma bay? We get all ready, hopefully, before they come, we know, and the EMS, or the the EMTs, bring them in, and we do a little bit of extended version of an algorithm of the BLS, or the CPR BLS. So basically, we do the A, B, C, D, E, and which is what I like because it's very simple. I can remember that. So the airway, breathing, circulation, disability, and exposure. That's our A, B, C, D, E's, and this is going to be, like I said, a very short, abbreviated version of this. So A is airway. So I generally ask somebody, hey, can you tell me your name? And so I introduce myself. My name is Dr. Parker. Can you tell me your name, and do you remember what happened? So I like to do that. At the same time, I put my finger on the radial pulse to make sure they have a pulse, and then if it's obvious that they have a pulse because they're talking, I want to know what that pulse is, because if you do this enough, then you're going to put your finger on the pulse and go, this is over 100 or under 100, which is important because over 100 is abnormal and under 100 is normal. Of course, too low is abnormal too, and you can probably feel that if you do it enough, but I like to know those things, and because that'll tip me off. Right? I'll say, while he's talking, he says, my name is George, and I got shot, and I feel his pulse, and I go, that's like around 120 to 130. Okay, something's up. Or I go, this is 85, and I'm not as worried about George. So if he says, if you got it in a car accident and he kind of goes blah, 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 then his airway is what we call not really intact, and he's not going to be able to get air to his lungs or oxygen to his lungs to get around the circulation, get oxygen to his organs. So At that point, we would have to get an airway for him, which is the tube and all that good stuff. But we're going to do this quick. So we'll assume his airway is intact. My name is George. I got shot. Two dudes shot me when I was reading a Bible. So his airway is intact. And I go to the B, which is the breathing. I look at the chest rise and fall. I make sure it's symmetrical. You take their shirt off, and you look at the chest. If one is moving and the other one is not, maybe there's an injury here, okay, that tips you off. I listen. I put the stethoscope in. The only time I put the stethoscope in is for this. I listen to the breath sounds bilaterally, make sure they're equal, and that I'm not too concerned about having a chest injury. Of course, if I see a big bullet hole there, then that's a problem. If I see a big caved-in chest on one side after a motor vehicle accident, then that's a problem. Obvious signs, but that's the B, short version. C is circulation. Now, kind of changing some stuff around. Sometimes recently, some entities are talking about putting the C first, because if somebody comes in the door and they are exsanguinating, right, they're bleeding to death, then you need to stop that before you do the A, but we're going to stick to the ABCs because I think it's easier for me to remember. Anyway, so the C is you want to look for bleeding. Okay, so if they're hosing out of their groin because somebody got stabbed in the groin, or they have an amputation from a motor vehicle accident and they're bleeding out of that, you want to stop that bleeding as soon as you can. And then go get to the next one. Okay, so the other thing we do with the C, though, is we get IV access, and that allows us to give them blood if they need it right away, and we usually give them a little fluid at the same time, or initially. And then a lot of these things are going on at the same time too, but we'll get blood and check their blood counts and electrolytes and all that other good stuff to see kind of where they're at, how sick they are if they're sick. That was C, and then what's next? Alphabet. D. So D is next, and D is disability. So this is like kind of checking for a head injury, and we have this little scale. It's called the Glasgow Coma Scale, and 15 is the normal, 3 is the minimum you can get. Like this remote control right here has a 3, GCS a 3. So basically, we're checking their eye response, so are their eyes open, right? Their verbal response, are they communicating? Is it normal? And then their motor response, is that normal? And if those things are not normal, then we kind of assume that they have some kind of a head injury. So that's their neurologic disability. So that'll tip us off to say, well, maybe they had a head bleed, or maybe they got knocked out or something like that. So that's D. And then E is exposure. You take their clothes off, you roll them side to side, you look at everything, make sure you're not missing anything that's obvious. If they get shot over here one time and everyone goes, yeah, he's shot right there, he's shot right there. You take their clothes off, you look at their back, and they got 4 holes on this side, and then you're like, oh crap, we didn't see that stuff. So you got to make sure that that you look at everything. So that's E, exposure. That's the quick version, of course, I told you before. But maybe that'll help you, like when you're come up on a motor vehicle accident, it'll help you kind of sort things out, or at least get started. I don't know. So you guys want to hear this stuff? I don't know. I think it's fun. I think it's cool. That's why I'm kind of doing these videos. If you like this kind of stuff, you should subscribe to my channel. You should totally subscribe. We're going to have fun. I'm going to do some more. I'm going to do the requests that you guys had. I know there's some snake bites. A lot of people want to talk about snake bites. We'll talk about that. Some other things, I can't remember what. There's a lot of requests, which is cool. I really appreciate all the comments and stuff, and hopefully you're having fun. I'm having fun doing them. I want to do more of them, but I'm only going to do them if I'm not bothering you guys too much. So awesome. That's it for today, and we'll see you on the next one. Take care.